Hello, everyone. Next in my series of Salute to the Heroes of the Pandemic COVID 19, we have Dr. Michele Harper. She is an ER physician in the city of New York, the New York City, which has been the epicenter of this virus, of the fight to this virus, with so many patients getting admitted. And she's at the front line being an ER physician, and her article that she wrote got published in elemental.medium.com. We can read it there. The article title was When This War is Over, Many of Us Will Leave Medicine. And we have to ask her what happened that day that pushed her to this feeling where she had to write this article. It's one ER physician's story recounting the stress of constant intubations and shortage of the PPE, which is the personal protective equipment. Let's talk to her.
Hello, everyone. In my series, Salute to Heroes, where I've been talking to a lot of physicians, frontline staff, people working in hospitals, healthcare workers, ER physicians, nurses, we have today with us Dr. Michele Harper. She is an ER physician, so she has been at the front lines through all this time. We are going to talk to her how it feels to be there in the epicenter. So, Dr. Michele Harper, welcome to our show.
Thank you.
So we want to get the feeling from you, being on the front lines, fighting with this disease, with this invisible enemy. How is it out there? How are, from the first week to till now, patients coming in? How are you dealing with that? Is some days good days, bad days? Are there some days where you feel you can't do this anymore? Please walk us through all of that.
Okay. Well, there has been a change, I think, as our knowledge evolves and also as we get processes in place so that we can handle this. I mean, in the beginning, it was all extremely frenetic. No one knew what to expect. No one knew how it would look. Certainly, there were shortages at that time, and there was no process for how to deal with it. We still have shortages, but we have more donations, at least. So there are companies who are, while we don't have the coordinated response we should have on a national level, there are individual companies that are stepping up and helping. So that has been a tremendous boon. So things like face shields, we have better face shields, for example, or even with donations of N95s. So that has helped. The team is becoming more coordinated in that respect. So even when it comes to processes of triage or having an emergency medical tent outside to help with triage, who comes in, who stays outside, how do we deal with surges and volumes? So as providers, we're getting used to it. I mean, of course.
So what does a day look like? Triage, what does triage look like,
Well, thankfully, the ER volumes have stabilized. In the beginning, we were getting surges, and not only of low acuity patients who were just scared, more presenting like your typical viral syndromes, truthfully, but a lot of anxiety around it. So we were having surges in that respect. And so some of those places, when we got the tent set up, some of those patients would go directly to triage and not into the ER, so we wouldn't be overwhelmed inside. Or to clinic beds that the clinic allowed the ER to use. But then we were getting a high volume of high acuity patients as well. So it was overwhelming. That has stabilized in terms of volumes. Volumes are down. I mean, truthfully, they're down for ERs nationwide. It gets challenging now because a lot of the sick patients have filled up the inpatient units. So that's difficult. Thank God, actually, the ER volumes are down because a lot of the issues we're seeing in the hospital have to do with not having an adequate staff.
Enough beds for them or enough ventilators for them in the ICUs and the floors.
Caretakers in the ICU or just regular floors, because we're seeing that the patients have prolonged stays in the hospital.
So when they come in and they are brought in by ambulance, if they are very sick patients, and then their oxygen is low, they're hypoxic, their pulse off. So you guys, you are the front line, you are your physician, so you get on with it. So intubations, you've done a lot of intubations for COVID positive. Do you test directly? Is that, and then do you have testing which is immediate?
Right. Testing is better. In the beginning, there were a lot more intubations. We're seeing now that we can use alternative strategies. It's a combination. Partly people are sick, but not as sick as we saw in the beginning. And now there are new guidelines where we can use things like high flow oxygen
Yeah.
and BiPAP. So that has prevented some of the intubations. Now, of course, there's risk. There's similar risks with aerosolizing with high flow oxygen and BiPAP, but they are ventilator sparing measures that are helpful to patients so that they do better medically as well, while sparing ventilators that we may need
For
for other
other.
situations. In terms of testing in the beginning, we really didn't have the test. I remember for weeks we had 40 tests for the hospital. We didn't know when we were going to get more, and it was taking 5-7 days to get results. It's better now. That it's more recently that it's better, where we have more tests and we have the rapid tests, which is nice. We still don't have enough, so it fluctuates who we can test. Currently, it's just people who are going to be admitted to the hospital, so sick enough to meet admission criteria, or symptomatic healthcare providers. But so it varies depending on how many tests we have. So we have more, we don't have enough.
And do you have the rapid test so that you can quickly tell if the
Yes.
patient comes in, if they are positive or negative, so you can decide accordingly?
Yes. Now we do. I'm always a little cautious with saying that, but because it fluctuates every day. But we currently do, and we hope that stays the case. And we also hope we have more. I mean, I would love to be able to test everyone. We just don't have that capacity.
Absolutely. We just need more tests, and hopefully that happens soon. It's already been quite long. So, and you were doing shifts. Were you doing 12-hour shifts?
No, it varies where I am. Some are 12. They're 8. Is 8 the shortest? See, I'm getting they vary. 9, 10, 12-hour shifts. There are times when we were short, so I would pick up some shifts.
Yeah.
We got to the stage where, in case the inpatient team needed help, whoever was willing volunteered for emergency credentialing. I volunteered. Luckily, it hasn't come to that on the inpatient side. But
yeah,
that's cool. But it's mainly we're going to see. It's a really cautious wait and see approach. It's a day by day approach, because we just don't know how things are going to look. And
we don't know if the virus mutates, whether people who are infected once can get it again, and can it be a severe illness?
Exactly, right. And what does immunity confer? What does that look like? And as restrictions open up, certainly, unless there's a miracle, certainly a virus will do what it does, which is continue to spread, and we don't know how cyclic it will be. So we're just trying to stay prepared. And I know you asked before, what does it feel like? Well, while the volumes have been down in terms of patients in the ER, which is a blessing because it's allowed us as a healthcare system, just as individuals, to prepare, the stress is still there. And it's this kind of chronic stress that I see is taking a toll on the healthcare providers. So the system is getting prepared. The individuals, though, there hasn't been time for them to prepare. We go in day after day. It's a chronic stress that you figure out ways to handle it on your own in your free time. I mentioned before the Zoom call how the only Zoom calls I did before this were for my yoga classes. Each of us finds strategy.
We all have to find our
with how to cope, but that part doesn't go away. So.
And it builds up, after doing shifts after shifts, and then not seeing an end in sight, having no treatment, nothing to fight, literally no weapons to fight. This thing feels more frustrating.
Right. It's just all supportive care for now, which, and I think probably as all physicians, and especially as ER physicians, we know we live with this a certain amount of comfort with uncertainty, where there are certain treatments we have for certain disease processes, and that are other times we just don't. It's just we do what we can in the moment to temporize the situation, and we
and that's one thing that touched me about your article when you wrote that we are ER physicians. We don't know what fear is. We are not afraid. We don't have fear. Because, and that's true, like ABCs, you guys, when I did one shift for a month in ER, and I was, of course, I knew I couldn't be that person, but ER physicians, it was such a working closely with them. I saw that's what they just follow protocols, ABC, airway, breathing and circulation and whatnot, and fix the patient, like stabilize them, and then they transfer over to flows. So when you said that one day, at that one moment, you had this thing which you didn't even know what that thing was, what that feeling was, and it was fear. For an ER physician to realize that they are standing in the place where they are most comfortable and are afraid of something, that feeling that you had that day speaks volumes about what this is and how fearful it is, because of the lack of treatment and because of the way it's hitting younger and elderly. First it was elderly, but then there were some younger patients that started getting, and then even now we have some people coming in with, bleeding clotting disorders, and some some new symptoms are every day are being talked about. So we don't know. Right. So, from in your terms, if you want to give a message to all of us, it is definitely social distancing, not just to sort of stop the spread, but also to contain it. Even if people will get immunity by getting the virus, yes, it should slowly. So reopening and all these things, it should still continue. Social distancing should continue.
Mm-hmm. Yeah, I do agree. I think we're going to have strategies of how to do this responsibly. I have to confess, I clearly don't have all the answers. None of us fully understands this.
Yeah.
Do we need testing? Yes. Do we need to continue social distancing? Yes. Will it be wonderful when there are treatments? Yes. There are some other factors, we kind of touched on this before the call, but I really feel that this illness, and illness always does, pandemics always do reveal opportunities we have to utilize treatments and social supports that we've neglected. For example, and I kind of started to touch on this in the article, where, for example, for frontline providers, whether it's people who are bank tellers, grocery store clerks, people who work in transportation, healthcare providers, there needs to be, of course, protective equipment, but then also we're asking these people to work on the front lines. They do need to be supported. What happens if they get sick? There should be paid sick leave. All of these people to begin with should have a living wage. I mean, I'm not really talking about physicians right now, I'm talking about everyone else, but should have a living wage so that if they do get sick, they can still support their families, whether it's a family of one or their two kids. I mean, these are things that people should have health care so that if they lose their jobs, which is what we're seeing, record unemployment, that they still have health care. How could people not have health care during a pandemic? And all of these things are being revealed. I just read, now excuse me, because English is the only language that I'm partially fluent in. So I may butcher names, but I just read an article by Arundhati Roy, who I love, and speaking about pandemic as portal. And she highlights beautifully what we're talking about right now, the issues that are revealed in society through pandemics, and how it's also a portal. It's an opportunity for us to say, well, if we really care about health, it's not just the vaccines, it's not just the medications for coronavirus, it's all these other matters that have contributed to morbidity and mortality that must be addressed if we're going to get through this better.
Right. Absolutely right, and as a, one of the most developed countries, these are the bare minimal things that our,
Right.
people should be provided with. Yeah. So in terms of going, forward, what is your take on this? What is your message, and what do you think collectively we should do?
Collectively, I recognize it can get very overwhelming because there are just so many matters to address. And that's one of the things, for example, we see in the ER. When patients come in, they're not only afraid about their health, of course, but they're afraid about, how many people I'm seeing coming in just anxious and afraid and not able to function, and truly coming in suicidal because they were just evicted because they can't afford their rent now, and they can't find a job because nobody's hiring. or people who, there are more articles about it, trapped at home with their abusers. I mean, there are many factors that need to be looked at. So what is my message? My message is, of course, when it comes to healthcare, for us to do what we can to protect our health and the health of each other. So social distancing, to the extent that we can, still maintaining the preventive measures that always work, like good nutrition, exercise, mindfulness. But then also, if we can keep in mind the factors that got us here, and just and pick the issues that we care about and address them, and to become engaged socially and politically. All these things are political. People say, I don't want to be political. Okay, well, sorry, they're all political matters. And if we want to prevent this from happening in the future, we have to be involved.
Right, right, absolutely. So you mentioned something about being a little bit holistic yourself
Yeah.
and believing in that. So what about that? Let us know about something about that.
Oh, well, I suppose broadly, I believe, and one of the things I love about being an ER doctor is it's a way that we can, well, determine if there's an emergent situation. And then if there is, we can treat it quickly, patch people up. I mean, in that ways, there are brilliant methods that Western medicine has to address, heart attack, stroke. It works for acute diseases in that dramatic way. But for most things, for most chronic disease, whether it's diabetes, cancers, allergies,
Arthritis,
exactly, arthritis, like depression, anxiety,
depression. Yeah.
it doesn't work so well.
We have no treatment, unfortunately. You're right.
Exactly. But there are other modalities that do. I mean, that even sound simple. If we talk about eating healthy diets, I don't like the word. I don't mean it in terms of dieting, but
right.
Focus on nutrition. Focus on. Well, for me personally, I do a lot of yoga all the time. I depend on yoga, meditation, having mindfulness where I try to have perspective on a situation. I mean, even when we talk about situations in the ER and knowing, part of the reason when I go to work, I'm willing to keep going to work and literally put myself in these situations that are potentially, life-threatening, especially now with coronavirus, is yes, I'm careful to the extent that is possible, and that is limited with our resources. But I also I've made peace with the risk. I'm not one of those people who says, I can do it because I know it's okay and I know I know there's a risk, and I have made peace with that. And it's just part of my mission and my calling. And so to the extent that it serves my mission, I will do it. So that reduces a lot of anxiety. And I think it helps me in general.
That's true. Like accepting who you are, where you are, and then taking it from there. But this is amazing what the healthcare workers, that's what they're risking their lives. They're risking, the lives of their near and dear ones, because they do go back home, and if they were, like they can carry it home, and they can be elderly at home. There are kids at home.
Right.
And so you guys are doing amazing work, and this should be the least people can do is by supporting it, and supporting it by just doing the right thing, just not exposing themselves foolishly to, at least doing like you have accepted people. I hope that this message goes out and people say to themselves, okay, who am I? Where am I? Accept that. Just accept that for a few weeks, that, this is who you are. You have to stay indoors and you have to social distance, just for saving themselves, and other people's life depends on it. Their own life depends on it. Other people's life depends on it.
Yeah.
So if we as a community, as a nation, together do this, we can fight this and we can win this, hopefully soon. But you guys are doing amazing work. Keep up the good work. Stay safe is what we can say. Our message is, and we are there behind you, cheering you on and bringing your stories to Frontline. Keep writing those beautiful articles.
Yes, I got to get back to work. I told you I was cleaning up my office today, so I'm getting back to work.
Yeah, that's really good, because we need to hear these stories, negative and all the news, yes, but we want to hear these positive stories of you guys doing, all this work out there. So it's amazing. So keep doing what you're doing. I'm really thankful that you decided to give us a few minutes of your time and come to our show.
It was my
Stay safe.
pleasure. It was so nice connecting with you, and stay
You
safe also.
too.
And thank you for what
Absolutely.
you do, because part of what will get us through this is just connecting and uplifting each other and keep
Exactly.
going.
It's rewarding and it helps. And some people are alone, is stuck alone in their homes. So,
Absolutely.
this is their only connection, the online. So the more positive they see, it will help us through.
Right. I agree.
All right. Take care.
But
Bye.
thank you too.